When we heard from Trump on March 31st, that we were going to have a very hard 2 weeks to expect 100,000 to 250,000 deaths, even with all of our isolation measures. And to date, at April 22nd, there's not been more than 37,000 deaths nationwide recorded. That is shocking to me that people are not questioning that huge difference of what was projected versus what we've actually seen. I am a respiratory therapist, so if anyone is having problems with breathing or if they need life support, I'm there for that. The hospital that I work at is in the greater Harrisburg area, so it's 5 minutes from the Capitol. So we do normally, it is a major hospital. Normally there would be a large volume of people coming in. So our workload so far has been low enough to the point where they are shutting down floors that would normally be used for people after surgeries, or other people are just not coming in because they're so scared of I might be susceptible to the virus. I have not experienced any layoffs or cutting hours, but nurses have experienced that. And I would say the thing that has been a little bit of a pause for me is that I keep on, when I'm going into work, we're hearing, okay, we're expecting the surge next week. Okay, maybe next week it will happen. And the number of cases, or my workload, has not, in a respiratory related way, has not increased at all. So I don't personally watch the news because it is kind of, I don't identify with what's being said when they're stay at home so that you don't overwhelm the hospitals. I literally have been assigned no assignment for an entire shift, where I'm just there to help if anything comes up, because there's that little of work available. Since COVID-19 has started, our role is the same, but all of the work that we normally would be doing on the floor has really significantly dropped because we're not seeing a lot of people in the hospital right now. So it's more in the capacity of being available if COVID-19 patients are coming in, since we've seen all of our other numbers drop so significantly. When I've been on the floors, there's not been more than 10 to 12 COVID patients at a time, and only 3 at a time that have been on ventilators. I'm not seeing anything that looks totally different or crazy from other conditions that we would see if someone who has a pneumonia. I think the most common when I get involved is because people are having respiratory distress, so the breathing faster or more shallow. I have seen patients where when we're measuring their oxygen, it's coming in lower, but a lot of them have been comfortable, even though their sats are reading that they're low, they've been comfortable and not requiring a ventilator or excessive oxygen. For people who have come in, there have been people in a demographic that would be more vulnerable, that even if it wasn't COVID-19, if someone from a nursing home came in and got pneumonia, there would be a high chance that could be lethal for them. And we've had people in that demographic come in, be on a ventilator and recover. So that has actually been pleasantly surprising to see. I have not seen any deaths with the patients that I've cared for. I'm not seeing anything that looks totally different or crazy from other conditions that we would see if someone who has a pneumonia. I think the most common when I get involved is because people are having respiratory distress, so the breathing faster or more shallow. I have seen patients where when we're measuring their oxygen, it's coming in lower, but a lot of them have been comfortable, even though their sats are reading that they're low, they've been comfortable and not requiring a ventilator or excessive oxygen. I have not seen, I've seen one person have a coughing fit and it was very short and they did not desaturate, and that's not saying that would be the case for everyone. I've not observed a lot of coughing. I've observed just more an increased respiratory rate. I only get called if they're having respiratory distress. I worked the ER a week ago, and in my 8-hour shift, I only got called once for one patient, and it was later determined that they had a bowel obstruction and were heavier breathing because of pain, because their chest X-ray was clear, and so that one that I called for the entire shift ended up not even being a respiratory-related symptom. I am seeing patients on the COVID floor, but there's so few of them that it just is not. I wouldn't be the person to talk to on seeing a volume of people because we haven't seen a high volume. The whole floors have been shut down, or there's been so few people that they have to call. You can't have 6 nurses for 3 patients. So yeah, there has been cut hours for sure. It absolutely is devastating financially because you're not at capacity in any way. We're well below 40% of what the hospital is capable of. And so that's going to affect services and revenue.